My name's Janet Treasure. I'm Professor of Psychiatry at King's College London. Thank you for watching this DVD. It's been developed to help carers learn and build skills that can provide support and care for your loved one. The scenarios in the DVD illustrate some of the evidence-based support skills, and we give you tips about how you can best provide support. We want you to be able to look after yourself, to role model good personal health care, to be emotionally intelligent, and to think about yourself, your relationships with others and with the world. By watching and re-watching this DVD, we hope you will learn communication skills and understand how the eating disorder helps a person make some sense of themselves. We want to give you an understanding of how people change and the psychology of change. Eating disorders have a profound effect on other people, both through the direct effect of the symptoms and indirectly by changing the person you know and love. It can seem as though the loved one has been overtaken by an eating disorder bully who sits resolutely on their shoulder, feeding them misinformation. It's important to banish the common assumption that somehow you've done something to cause the problem. Guilt is often not only misapplied, but can trap you into responding with harmful behaviours. Parents, partners and close others can be part of the solution, not part of the problem. Remember, you are a resource. Eating disorders can and do put tremendous demands on the coping ability of family members. In addition to getting information and developing skills to manage the illness, scheduling time to relax and recharge is also necessary. Getting better from an eating disorder involves changing the things that keep the symptoms going rather than those that started it. We can change things in the present, but not those in the past. We conducted high-quality scientific research which found that when carers adopt the skills and approach demonstrated in the DVD, they become less stressed and more effective. Most importantly, we found that people with an eating disorder also greatly benefit from the repair in the relationship that follows. Listen to what Anna found when her family got involved.
My parents definitely neglected their own needs throughout a lot of the early stages of my eating disorder, because they were so wrapped up in worrying about me and also so wrapped up in the eating disorder, I think, themselves. They would very much live their life through me. My mum started cancelling quite a lot of her kind of social engagements and things because she was worried that if she wasn't around then I wouldn't prepare myself any food or I wasn't going to eat. We all became quite too much of a sort of close-knit family. I think by going on the carers course and being involved with other carers, they actually realised that that completely wasn't helping me, and it certainly wasn't helping them, and they had to explore life outside of having a daughter with an eating disorder, and they started re-engaging with their old kind of social life and their old hobbies, really, which also gave them some pleasure. And because living with someone with an eating disorder is unbelievably stressful, and a lot of worry and anxiety is generated, and that gave them some release as well. And I think that from talking to other carers, they actually found that they had permission to do that, whereas before I think that there was a lot of guilt associated with actually spending time away from me in case I didn't eat, in case I misbehaved in some way. I think my parents changed through the Maudsley method in a number of ways. My dad, first of all, became far less aggressive and dampened down his temper towards me, I think, which was really helpful for the home environment, because my parents would then argue between themselves if my dad became very angry with me. I think my mum managed to get out of her shell a little bit and managed to socialise with her friends again and take up a number of her hobbies, but also she was less protective of me and allowed me to make some of my own decisions. And if those decisions were the wrong decision, we'd go through it afterwards and we'd discuss what had happened, and she was less emotional, and that did help me, because with her emotion I then felt a great sense of guilt about my behaviour and how the eating disorder was affecting everyone in the family, and her dampening down her emotions meant that I felt less guilty. Before my parents embarked on the course, my mum was very over-emotional, and she also did a lot to protect me and to try and, in a way, she thought she was helping, but actually it was more helping my eating disorder thrive. She tried to we had a lot of conversations that I would try and ruminate and try and stir eating disorder chat up with her, and she would fall into that trap, and which is exactly what I wanted to talk about. And she managed to change those things. And with my dad, he was very aggressive towards me initially, before he went on the course, and he couldn't really understand my thought process or why it wasn't easy for me to change, and I think just by learning a bit more about eating disorders in general, he actually appreciated why my behaviour was as it was and why I was finding it so challenging to change. In terms of advice for a carer, I think it's very difficult when you're dealing with someone who's very resistant to change and doesn't want to change and has no aspiration to change. However, definitely for me, there were always points, even though I was very resistant to change, that I actually thought to myself, is this how I want my life to be? What am I doing to myself? I looked around me at the other people who I was in hospital with, and I just thought, oh goodness, am I going to have to go through this treatment process as many times as they have gone through? And so there were always tiny little glimmers that I actually thought, I could potentially get myself out of this situation. But when the food's on the table, that glimmer and that idea that you have a future completely gets destroyed. And my parents were very good at actually picking up on those little tiny glimmers and actually rolling with them and saying, come on Anna, it's not about the food, at the moment this is what you have to do, but think about what you want to do in the future. And having someone to put things into perspective was really, really helpful for me. I found that the Maudsley method really benefited me in terms of when I actually left a structured treatment programme. In the treatment programme, everything was very set up and I was very safe and secure there. But when I was let into the outside world, as it were, I was fending for myself, and I had good days and I had bad days. And my parents were there to support me through the bad days and give me advice, and they knew how to support me from the skills that they learnt using the Maudsley method. On the good days, they also knew to trust me and to let me have my own independence and freedom and try and get through the eating disorder by myself so that I could be independent.
I really want to be involved in helping my wife, Jane, and in helping my daughter, Louise. I'm a bit lost in knowing what I can do. I really want to be part of the recovery process because, well, Louise and I were close when she was younger. We used to do quite a bit together. I used to take her, swimming. We'd take her to dance classes. She was interested in art. I used to take her to the football. But I think over time, I've made work an excuse. I think I became really nervous about getting too involved. I was really worried about her, but I didn't know how to show it because I sort of felt that whilst Jane was doing most of the caring, I had to be really strong. Just, providing standards of living and making sure that we were economically safe. So I didn't really spend much time with either of them. I'm a very solutions-focused person. So I just couldn't understand why Louise wouldn't just eat, because she knew that was what she needed to do to recover. I also felt that if I could understand what caused this illness, then we as a family might be able to prevent it from happening again. Once I was able to take a step back, I realised that we might never get the answers to the why questions. And I was more able to help Louise think about her plans for the future.
Complex illnesses, such as eating disorders, are not as simple as A causes B. They're more like a pinball machine with many places within genes and the environment that can alter the course that life takes. Treatment can be particularly effective if it focuses on factors that cause the illness to persist rather than those that have caused it. And you as carers can have a role to play by making sure that you create a healing environment. However, how to do this is not obvious, and it's easy to hinder rather than help. This is a reason we've made the DVD. With perseverance and support, I'm sure you'll help your loved one towards recovery.